Meet Jim. Jim was diagnosed with asthma 2 years ago. Jim is due to see his PCP, Dr. Smith. The day before Jim's appointment, the scheduler in Dr. Smith's office logs into the system for UPIM, goes to the patient communication tools, and sends Jim an email confirmation for his appointment with Dr. Smith. Also the day before Jim's appointment, Dr. Smith's office manager logs into the office's system for UPIM and goes to the practice management solution to review the patients on the next day's schedule. He then easily navigates to the web portal for Jim's health insurer and checks Jim's health insurance eligibility and benefits. Along with Jim's E&B information, the office manager receives a clinical alert from Jim's health insurer's clinical analytics tool, saying that Jim is enrolled in its asthma management program and that he is overdue for an appointment with his pulmonologist, Dr. Jones. Still in the system for UPIM, the office manager goes to the EMR and enters this information into Jim's electronic medical record for Dr. Smith to see the next day. From the same system for UPIM, the office manager accesses patient communication tools and securely emails Jim to let him know that his health insurer provided information about his participation in its asthma management program, and to be sure to discuss this with Dr. Smith. Jim goes to Dr. Smith's office for his annual checkup. At check-in, the receptionist logs into the system for UPIM, goes to the practice management tools, sees that Jim has supplied his pre-registration information in advance via secure patient communications, and then thanks him. From the same system for UPIM, she goes to Jim's health insurer's web portal to use the patient payment estimator and lets Jim know what his out-of-pocket cost will be for the visit. Before seeing Jim, Dr. Smith logs into the office's system for UPIM and goes to the EMR to look at Jim's medical record. Dr. Smith sees that Jim is enrolled in his health insurer's asthma management program and is overdue for his visit to his pulmonologist, Dr. Jones. Dr. Smith also sees that he does not have the report from Jim's last visit to Dr. Jones, so he uses secure provider-to-provider communications to email Dr. Jones's office to request it. Dr. Smith goes in to see Jim, taking his handheld with him. He logs into the office's system for UPIM from his handheld. Dr. Smith receives the report electronically from Dr. Jones via the secure provider-to-provider communications. He also gets a new clinical alert via the health insurer portal, telling him that several days ago, at a local hospital's ER, Jim sought emergency treatment for an asthma attack. The alert also points him to information on evidence-based best practices for asthma management supplied by the health insurer's decision support tool. Dr. Smith talks with Jim about how to better manage his asthma, and tells him that he is emailing him some data and resources using secure provider-patient communications. This information empowers Jim to change his behavior and manage his own care, and also qualifies Jim and Dr. Smith for health insurer incentives. Dr. Smith wants Jim to see Dr. Jones, the pulmonologist, and enters that information for his office staff to access from their PM and EMR. Dr. Smith then recommends a new mobile application that Jim can use to more easily record his asthma care management on the go. The app is set up so that Dr. Smith and Dr. Jones can access Jim's data via their handhelds or from their home or office PCs, so they can track Jim's progress from wherever they are. Now Dr. Jones and Dr. Smith have access to the most recent information about Jim's care, and should Jim ever need emergency treatment again, the ER can access it too. Jim's health insurer now has better data on asthma disease treatment and management, insights that can be shared with other members and physicians in the network. Before he leaves the office, Jim visits the checkout desk and asks to get a referral to see Dr. Jones. The checkout coordinator logs into the system for UPIM and submits a referral request to Jim's health insurer. She also sends a secure email to Dr. Jones's scheduler requesting and confirming an appointment for Jim. At Dr. Jones's office, the referral coordinator logs into their system for UPIM and confirms that Jim's health insurer has authorized the referral. This is UPIM in action. Today, IT vendors and data providers are innovating to put into place the foundational elements for UPIM, so that in the not-too-distant future, comprehensive UPIM will be the reality across the country.